the comments are usually quite rough. The comments are like, well, he doesn't know what he's talking about. Chronic fatigue, fibromyalgia, migraine headaches, digestive disturbances, problems with women's cycles. This is a serious problem, and it's only going to be helped by looking at your nervous system, and that's where we come in. Welcome to My Pods Podcast. I'm Dr. Joe Schneider, and after 35 years as a functional neurologist, a personal journey through stroke recovery, and helping thousands of patients, I'm here to share breakthrough solutions for POTS and neurological wellness. From getting out of bed in the morning to rebuilding your nervous system, this is your guide to understanding and overcoming neurological challenges. Let's begin this journey to recovery together. Hello, Dr. Joe Schneider, and I'm talking about POTS. This is My POTS Podcast. This is going to be a real short one. It's for a level of clarification that we've been getting comments from our podcast and comments in our TikTok saying that I will say postural orthostatic tension syndrome. So the feedback is that I should be saying postural orthostatic tachycardia syndrome. Well, they're basically the same thing, although there's a implication on both of them. Now, POTS is not just tachycardia. It's not an increase in heart rate only, because you're going to be measuring when you do a vital scan, a scan of the way your blood pressure is going, the way your heart rate is, and your oxygen content in your blood. So with normal homeostasis, as you change positions and you do different activity, then your blood pressure needs to fluctuate up from lying down to sitting to standing, fluctuate up and not down. What we're seeing in POTS, a postural orthostatic tension syndrome, a hypotension happening where your blood pressure drops when you stand up. No way should it be going that way. And it drops so much that people pass out, that they have syncope, that they have visual, their vision goes out on them. And so that's what we're looking at. We're looking at postural orthostatic tension syndrome along with postural orthostatic tachycardia syndrome. So the comments are usually quite rough. The comments are like, well, he doesn't know what he's talking about, so, don't go there. Well, I think we have analyzed the postural orthostatic tension and tachycardia, and we've described it the right way. So if you listen to our content, you'll understand that the neurological controls of our autonomic nervous system should maintain a homeostasis. So we should have no problem standing up or sitting down or walking up steps and things like that. So when your nervous system, especially the nervous system that controls heart rate, that controls blood pressure, the circulation, and controls your oxygen, is all being done together and being done properly and being done right. So it's a very complicated subject when you start thinking about how the nervous system does that. So we have in our autonomic nervous system, we do have a peripheral nervous system, the sympathetic, parasympathetic. And we all say that the sympathetic is the fight-flight system, and the parasympathetic is the rest and digest system. So there's a lot of information out there, and we're trying to, with the podcast, to educate patients on what should be happening normally. Now, if you walk up steps, you feel dizzy, you pass out, you fall, you hurt yourself, and you'll probably get a concussion, or you'll probably break a bone or something like that. Falls are the worst thing that can happen. The other thing that's happening is that with the nervous system, and the nervous system being weakened, degenerated, traumatized, that people are ending up with a horrible condition that affects their life. So we talked about the comorbidities already. The comorbidities of chronic fatigue, fibromyalgia, migraine headaches, digestive disturbances, problems with women's cycles, problems with your kidney and bladder, your genitourinary system, are all being affected. People can't get out of bed in the morning. They can't do their job. They can't take care of their children. This is a serious problem, and it's only going to be helped by looking at your nervous system. So, how do we look at their nervous system? We're going to look at your nervous system by doing a qEEG, a quantitative electroencephalogram that looks at communication of all the lobes of the brain. And when we do that, we know that the brain is involved in our functioning of the autonomic nervous system. We know that our subcortex is. We did a segment on the thalamus. The thalamus drives the brain's sensory systems, and the thalamus drives your hypothalamus pituitary. And it also has some neurological connections to your sphenopalatine ganglion and your trigeminal ganglion. So the more you listen to the podcast, the more you're going to put it all together. And you're going to understand that there are many types of controls through the brain to the body and the neuroendocrine system that create different problems when it's damaged. And it can be damaged from neuroinflammation, it can be damaged from pathology, it can be damaged from toxins in our system. It can be damaged from mold infections. It can be damaged from COVID. It can be damaged from vaccines. So once it's damaged, then the concern is, do you want to manage your POTS or your dysautonomia or manage it for the rest of your life? No, you don't. You want to regenerate damaged systems within the body and the brain. And to do that, you need the proper diagnostics and you need the proper treatment. And that's where we come in. So I'm Dr. Joe Schneider from the Hope Brain and Body Recovery Center, and from my POTS podcast, coming to you from Chadsford, Pennsylvania, and looking forward to hearing from you if you have trouble with a POTS diagnosis and even more, a wider diagnosis of dysautonomia. Thank you. Thank you for joining us on my POTS podcast. If you're looking for more support, visit us at hopebraincenter.com or follow our journey on TikTok, where we share daily insights and inspiration. Remember, healing is possible. I'm living proof. I'm Dr. Joseph Schneider, and I'll see you next time as we continue exploring paths to recovery.